Hello, my name is Dr. Michael Mack. I'm one of the residents here at the University of Calgary, here to explain cataract B, intracapsular tissue, irrigation and aspiration level 2, 3/4. So in this particular exercise, you have 3/4 of cortex left that you have to irrigate and aspirate. So similar to the techniques I described earlier, you want to be able to grab a large piece and then with minimal aspiration. So you don't want to put too much metal to the pedal, so to say, or use too much aspiration because you may accidentally engage the anterior capsule and then cause a capsular tear. So you want to engage a part of the cortex and then start to pull towards the center so that a large piece can come off versus trying to irrigate and aspirate small little pieces. So there's a relatively clean capsule, and then that looks quite good. One other tip I want to share with you is that you should try to go into the OR machine and then put on irrigation as continuous. So that way you don't have to be in foot position 1 when you're entering the eye. So here I'm using a 45-degree irrigation aspiration tip, and it's relatively the same. All I would recommend is that when you're using the red probe in the simulator, to actually push it down a little bit because you may accidentally hit the cornea for a irrigation aspiration tip. It's just the setting of the machine that doesn't really simulate real life very much. So there I've cleaned up most of the capsule, and then I'm pulling out and making sure that I'm not engaging the cornea. So I scored 100 on both. Here's some examples of what you shouldn't do. So remember that the tip should always be facing up, and if you're pulling in and out too quickly, you may accidentally pull a large piece out, but then also engage the anterior capsule. So actually, if you see here, I've engaged the cortex, but I've also engaged the anterior capsule, and I'm not sure if you noticed, but there's a large tear. So there, I pulled the entire anterior capsule off, and then I've destroyed or caused zonular loss. So you can tell from the bright red edges that some of the capsule has been disengaged from the zonular fibers, which is an automatic fail. So remember, try to grab just the cortex, use minimal aspiration, and try to be efficient with your technique. So pull large pieces towards the center and make sure that your IA tip, the little hole, is always facing the top. So please like and subscribe for more videos, and thanks for watching.